Congress returns its session next week, where members will debate issues including health care, climate change, and financial reform. For more, we're joined by Mathias, Director of Research for Concept Capital's Washington Research Group, speaking to us from Washington. Ann, good morning.
Good morning. How are you?
Well, we're seeing a real change in tactic here on the part of the White House, right?
Yes, definitely. And we expected this. We thought a little while ago that things were spinning a little bit out of control, at least in the media, on the health care front. And one criticism of the approach of Obama to the health care reform that we're starting to hear on Capitol Hill is that he hasn't really laid out in a specific form his plans for health care reform. He's laid out the goals he'd like to see reform achieve, but he hasn't laid out really more concrete parameters. And his speech coming up is one attempt to do that, to kind of recast the debate, put people back at the table and working again in Washington.
Well, the Clinton plan was all spelled out, and Congress just picked it apart. So the Obama administration plan originally would just sort of, set some parameters and try to get something done. Of course, Rahm Emanuel was involved in both efforts. Is this one going to be even more any more successful?
Well, I think it already has been. I mean, he has already gotten Congress behind the idea. He has managed to not alienate everybody. In fact, he and his administration have tried to be the anti-Clinton, really, almost in every respect with health care reform. And perhaps they went a little bit too far by not being specific enough. And that's kind of created some of the problems that have occurred over the course of the summer, that people are concerned. There are big changes coming, but there are so many different plans, and there's no concrete proposal, there's no there that people can react to. So they're kind of reacting to an information vacuum and concern about changes to something that's very important to them. And Obama's attempt in his speech soon to address those issues is he's trying to sort of thread the needle. He's trying to put some specifics on the table for Congress without becoming a sort of Clinton-esque provider of an entire bill and saying, here, you just do this, which is something he's avoided doing from the beginning.
Well, is the White House at a point now where it's going to take anything? Just give me something so I can say we did health care reform and we can move on to something else.
Well, we have always felt that the health care reform effort would get smaller, and we still see that happening, that the talk of $1 trillion-plus bill is something that's probably just not going to get any real traction here in Washington. And there's always been a fallback plan. There are a couple of things that have to be done in health care this fall, and the fallback plan is to do something to reform the private insurance market, to make it more competitive, to create a sort of national insurance exchange, and to do something about people with pre-existing conditions. Then you can do a few more things with delivery system reform, trying to take care of patients in a more comprehensive fashion so it's not so hodgepodge the way it is now. And you can call that health care reform, call it a down payment on health care reform, and move forward. And that's probably what we will end up seeing happen on Capitol Hill.
Ann Mathias, Director of Research for Concept Capital's Washington Research Group, speaking to us from the Bloomberg Washington Bureau, and we'll have more with Ann coming up in a few minutes. Our guest is Ann Mathias, Director of Research for Concept Capital's Washington Research Group, speaking with us from the Bloomberg Bureau in Washington. And would it be correct to say that health care, whatever form it takes, is going to have to be out of the way before anything else gets done in Washington?
Well, no, actually, I think that's not correct. I think it was sort of interesting. I was listening to your prior story on the expense of college education. And what Congress is going to do, they're saying September 15th is a deadline, but really for health care reform, it's December. They need to get something done by the end of the year. And right now, we believe when they get back next week, they're going to turn to a few things that they can get done. They need a couple of legislative victories to talk about. And one thing that we think they're going to turn to is education reform and improving Pell Grant funding, trying to make college more affordable, something that's sort of political red meat that everybody likes. It's really hard to argue against making college more affordable for people. So they're going to turn to that. Then there's a whole slate of other things: financial services reform, energy reform, tax bill that needs to get done before the end of the year. So there are actually a lot of other legislative priorities. And I think that the congressional strategists are going to look for places where they can achieve some early wins.
Tom Keene is in the studio with us, Bloomberg editor-at-large. Tom, they've only been talking about college tuition reform for what, 50 years?
450 years.
Something like that.
Ann, good morning. You mentioned earlier recast the debate. Is anybody recasting the debate when you see the deficit where it is? I mean, there's all these good intentions, whether right or left. How does the new view on the budget constrain them as they come back to September?
Well, I think it does in a sort of a philosophical sense. I think that deficits aren't really won and lost. I mean, elections aren't really won and lost on deficits, but it is important. And so any program that looks like a massive expansion of the government, any program that someone can point to and say, oh, look, they're all becoming socialists and it's going to cost us a lot, those types of programs I think the Democrats in Congress are going to try very hard to stay away from. And for example, one concrete example of that is in the climate change area. And we have pretty low odds for a very comprehensive climate change bill. We think that Congress will probably scale back and do something that's focused more on energy and renewable energy rather than trying to implement a significant cap and trade program, which is for sure going to get branded as a sort of socialistic expansion of the government by opponents on the right.
And out of the August recess, is there different shades of Democrats now? If they're the majority party, do they come back more cohesive or do they come back more separate?
Well, I think they need to seem like they're more cohesive, and for that reason, they're going to focus on things that they can all agree on, like education reform as a first step. I do think that there were some divisions that were deepened in the Democratic Party over the summer, but I don't think that the party has completely fallen apart, and I don't think that bipartisanship in the Senate between Republicans and Democrats has utterly been exploded by this town hall horrors of the summer.
Ann Mathias, Director of Research for Concept Capital's Washington Research Group, speaking with us from the Bloomberg Bureau in Washington. Thank you, Ann.